My name is Lou Tumolo. I am the managing director of Medicare Coach LLC. I have been involved deeply in the Medicare consulting space for several years now. And this may seem as if I am counting myself, but I can consider myself to be virtually bulletproof when it comes to this. I have come across pretty much every different scenario that you can imagine with respect to Medicare and transitioning to Medicare and the different plans and options. And I am AHIP certified, which is an important certification. It's required by the federal government and by the various insurance companies. And the AHIP certification, it's an annual certification that requires a solid 8 hours, and you need to take a final exam. And here's the point: that final exam, you can't pass with a 70. You must pass with a 90. Uh, so just to give you some perspective, I am 70, and to pass with a 90 in any exam is a challenge to begin with. But at this point in life, it becomes a greater challenge, although over time you get a better understanding of what they're looking for, what they're asking, and your experience helps to drive that forward. I am going to encourage everyone, as Craig did, to ask questions throughout the presentation. There is no bad question. The only bad question is the one that you don't ask. The only caveat here is that if I think it's a question that might take too long, uh, I will ask that we defer that until later, and I will stay around or speak with you one-on-one to answer that question as completely and fully as possible, if that's okay, if that's fair. But please feel free to raise your hand and ask questions, and we'll address them as they come through. Let me just want to move this up. There we go. Okay. Uh, so let's get started. We're going to cover pretty much from A to Z, what it takes to transition to Medicare, essentially how Medicare works, what some of your options are. What I'm going to cover as well are some of the nuances of Medicare, and specifically transitioning to Medicare, that everyone needs to be aware of, because not being aware of these nuances can cost you federal penalties, can cost you gaps in coverage, which could be devastating should you wind up without insurance coverage. And I'll highlight a couple of situations that have come to pass that resulted in some challenges of no fault of my own, mostly because uh, folks didn't search out the help and guidance and direction they needed and tried to do it on their own. So with that being said, let's move forward. So issue number one, we want to make sure that in all cases there's a smooth transition from employer insurance to Medicare. And in order to do that, we want to make sure that we avoid late enrollment penalties. And a late enrollment penalty, just so you know, we'll probably cover this later, can be 10% of your Part B premium for life. And I can tell you that the government is unrelenting and unforgiving on those penalties. Additionally, avoid gaps in coverage, where if you should have enrolled in Medicare and you didn't on time, you won't be able to enroll in Medicare until a later date. And you won't have any healthcare coverage, depending on whether you were entitled to COBRA or not entitled to COBRA, and so forth. Secure adequate coverage with private insurance, fill the Medicare gaps, cover prescription drugs. So these are the things that need to be addressed in terms of ensuring a smooth transition from employer insurance to Medicare. Additionally, issue number two is understanding your costs, your first year costs. All premiums must be paid out of pocket when you're on Medicare. There are no employer subsidies. Additional costs that can come into play are dental, copays, and other things. Medicare, basic Medicare itself, by the way, does not cover dental, vision, or hearing. It also doesn't cover, and we're going to cover this in more detail, but while I'm speaking to this, it also doesn't cover chiropractic care unless you're diabetic. It doesn't cover, podiatry unless you're diabetic. It doesn't cover chiropractic care except in certain instances, and it certainly doesn't cover massage, which I happen to be a huge fan. Uh, so these are things you need to be aware of as you transition to Medicare. Uh, Additional lifetime healthcare expenses are long-term care. Medicare does not cover long-term care, and I know that ICG Next has another meeting next month. I think it's November 20th, and Craig will go into more detail and remind you about this, specifically addressing long-term care. I encourage everyone to participate in that meeting and that presentation to get a better understanding of long-term care and how it works, because a rude awakening for a lot of my clients is that Medicare doesn't cover long-term care. And 7 out of 10 of us, they estimate, are going to need long-term care coverage. So we're going to talk about how Medicare works with employer insurance, who needs to enroll in Medicare and when, how to enroll in Medicare, how private insurance works with Medicare to provide complete coverage, and then how much you can expect to pay after transitioning or going into Medicare. So how does it work with employer insurance? So if you're 65 or older and entitled to Medicare and covered by a group health plan because you or your spouse are still working and the plan covers 20 or more people, who pays first? Your group health plan does. Who pays second? Medicare does. So if you work beyond age 65 and you're covered by a group health plan that covers more than 20 people, that's a critical number, you Medicare will be secondary, but you don't even need to enroll in Medicare. I get calls all the time from potential clients, prospective clients saying, "Hey, I'm turning 65, but I'm going to continue to work. My friends, my neighbors, my colleagues, my relatives are all telling me that I need to enroll in Medicare Part A." And I'm here to tell you, please do not listen to your friends, neighbors, relatives, and colleagues. They mean well. I have the same relationships you do, and they all mean well, but they just don't know all of the rules. You do not need to enroll in Medicare Part A when you turn 65. End of story. You can. Medicare Part A is free, and Medicare Part A would be secondary to your group plan. But I am a living example of the fact that when Medicare is secondary to a group health insurance plan, they pay a big fat goose egg, nothing. But if you want to enroll, you can. You just don't need to. Now, here's where it gets really critical. A group health plan, you're enrolled in a group health, covered by a group health plan because you or your spouse are still working and the plan covers fewer than 20 employees. Fewer, even if it's 19, that's fewer than 20. When you turn 65, it is mandatory that you enroll in Medicare. Medicare will become your primary coverage. That group health plan that covers fewer than 20 people will pay second. However, there's a big but here. I have hundreds of clients, and I spoke to a client just last night about this. I have yet to find one of those small group health plans that actually even works with Medicare. So what will wind up happening is that you will continue to work, you will transition to Medicare, and then more than likely you would enroll in either a supplement or Medigap plan. And those two terms are, by the way, interchangeable. Or you would enroll in a Medicare Advantage plan, which we'll talk about a little bit later. But in almost every single case, in fact, in every case I've been involved with in this situation, that small group health plan did not work with Medicare. And as an example, with this client I spoke to last night, her employer is actually paying for the full cost of her group health. It's an employer that has fewer than 20 people enrolled. Her employer is paying $1,000 a month for her coverage. her employer will be ecstatic when she goes to Medicare. And because if he wants to continue paying, his costs will be cut more than 50% for her. So her costs will be under $400 a month with coverage that's as good as and most likely better than what she has now. And he's going to save himself over $7,000 a year and keep her happy at the same time. So key here, fewer than 20 employees, you must enroll in Medicare when you turn 65 if you're going to continue to work. If you're covered by a group health plan with retiree coverage, again, you must enroll in Medicare A and B. Medicare is your primary coverage, and your retiree coverage can act as your secondary coverage. That's going to depend on whether that retiree coverage lasts for life or whether it's for a specific period of time. So you need to determine that. And my role, again, is to help you understand and determine and work through and navigate all of these different rules. The last option is COBRA. This one can be a real slippery slope. When if you transition to COBRA when you're 63 or 64, and then turn 65 while still on COBRA, you don't have the 18 to 36 months to be on COBRA. As soon as you turn 65, you must enroll in Medicare. Medicare will become your primary coverage. COBRA will be your secondary coverage. Here's the risk. If you don't enroll in Medicare at 65 while you're on COBRA, COBRA is only going to pay 20%. Now, in the event of let's call it a catastrophic illness, COBRA may step in and pay that bill, but then guess who they're going to bill for that excess coverage they had to pay for? They're going to bill you because you should have enrolled in Medicare, which would cover 80% of your costs, and Medicare would cover the remaining, COBRA would cover the remaining 20%. Any questions on this so far?
Lou, we got one question. It says, if you're a consultant self-employed without employees, I'm assuming that you're paying for your insurance and therefore at 65, because you have no employees, you'd be going right to Medicare. Is that correct?
That's absolutely correct. If you're 65 or older and you're an independent consultant with no employees, more than likely you are using the Affordable Care Act, or depending on the state you reside in, New Jersey Direct, or in Pennsylvania, it's called Penny. I forget what it's called in New York, but you would have to enroll in Medicare. Good question. Thank you.
Mhm.
Okay, so who needs to enroll in Medicare and when? And this happens all the time. Let me move this. You think I've done this enough times, you think I would have it memorized, but I don't. So if you're under 65 and working, continue with your employer plan. You don't need to enroll in Medicare yet. Simple story. Stay with your current employer plan. If you're under 65 and retired, no Medicare yet. You don't enroll in Medicare until you're 65. Does former employer offer a retiree plan? You need to know that, and we would address that. Can you get coverage on spouse's plan? And that happens from time to time. And I am a perfect example of that. I'm 70, so don't be fooled by my youthful appearance here. My wife is still employed. She's a member of NJEA, and that's the New Jersey Teachers Union. She's a secretary in a middle school, challenging job, and I'm covered under her group health insurance plan. I do have Medicare Part A. I can vouch for the fact that I had surgery 3 years ago, and Medicare paid zero towards my cost for surgery. I paid zero too because our coverage is excellent. But even though I have Part A, even though it's free, they didn't. They Medicare didn't pay anything. So perfect example of that. I'm covered under her plan. I'm 70. I haven't transitioned to Medicare yet. No spousal or retiree coverage. In that case, purchase health insurance on your state insurance exchange. Again, in New Jersey, that's New Jersey Direct, or Pennsylvania, it's Penny. New York has their own program, but it's all bundled. It's all part of the Affordable Care Act. Now, when you turn 65, if you are enrolled in a state insurance exchange program and you're receiving a tax credit, you will lose that tax credit when you turn 65 and become eligible for Medicare. You have to enroll in Medicare at 65. So stay on your employer plan and delay Medicare. Talk to your benefits administrator to see if you should enroll in any part of Medicare. I am going to caution you. I have several instances where HR and benefits departments gave inaccurate guidance and advice. Uh, my recommendation, uh, if you're like me and you want to speak with me, fine. Again, there's no cost at all in any way, shape, or form to do that. Give me a call. We'll set up a meeting, or find someone that you can trust, and make sure that you get the right guidance and information. So uh, you may be advised to enroll in Part A, which is free and provides good hospital coverage. I'm here to tell you that it, depending on the plan you're enrolled in, your group plan, it may not provide any hospital coverage at all. So uh, this is a real critical and important caveat. HSAs, or health savings accounts. If your employer plan is a high deductible plan, high deductible health plan with an HSA attached, which is a health savings account, you will need to make a choice at age 65 if you're going to continue to work and maintain your enrollment in your employer's group health plan. That choice is, do you want to continue to make contributions to the HSA, or do you want to enroll in Medicare or in Medicare Part A? You can't emphasize it enough, enroll in Medicare if you are contributing to an HSA. In fact, you need to stop contributions to the HSA 6 months prior to transitioning over to Medicare. Let me say that again. You need to stop making contributions to the HSA 6 months prior to enrolling in Medicare. You cannot be enrolled in Medicare, even Part A, which is free, while still enrolled in an HSA and making contributions. That being said, I am a huge fan of HSAs. And here's the reason. The money you contribute to an HSA goes in on a tax-advantaged basis. When the money comes out, by the way, that HSA follows you when you separate from service, terminate your employment, and or retire, and that HSA stays with you. You can then withdraw the money federal income tax free from the HSA. Now, remember, it went in with no taxes being due on that contribution, and now you're able to take it out on a tax-free basis to help pay your Part B monthly premium, which we're going to get to in a couple of minutes. So it's a huge advantage. And candidly, if you're 65 and still working and contributing, you have a high deductible plan with an HSA, I don't see any reason to disenroll from that HSA and enroll in Medicare, just to enroll in Medicare Part A. Take advantage of that tax benefit. It's a great benefit. Questions on that?
There is a question about, what about an FSA?
It's okay. FSA is fine. No problems with an FSA.
So you can continue to participate in that.
Yes, you can. Yes. Good question. Thank you for bringing that up. I should have said that. So if you're over 65, does the plan cover 20 or more people? I think we beat this one up enough. I don't think there should be any questions on this. If it covers more than 20 people, you don't need to do anything and you're going to continue to work. If it covers fewer than 20 people, you have to enroll in Medicare. We, this we all covered. Another key caveat, though, is that a lot of high deductible health plans with an HSA do not have what the government considers a creditable drug plan attached to them. Every year, your health insurance carrier should provide a letter that confirms that their drug plan is creditable. I just received one. We just received one ourselves from my wife's group health insurance company. And if you're in a high deductible health plan with an HSA, you need to ask if you're over 65 and you're staying with that plan because you're going to continue to work, you need to ask for a copy of that letter to ensure that that drug plan that's attached to that group health insurance plan is creditable. Because if it's not, for every month you are not enrolled in a creditable Part D drug plan, the government will assess another penalty of 1% per month for every month. So let's say you're 65, you never ask for this, you don't know that your plan is not creditable, and at 68, you decide to retire and enroll in Medicare. They're going to look back and determine that for 36 months, you had a Part D drug plan or a drug plan that was not considered creditable. You will pay a penalty of 36% of the average cost of a Part D drug plan as a penalty for the rest of your life. Now, drug plans don't cost $100 or $200 a month. The average drug plan is about $40 a month. But if you do the math, even 36% of $40 is another 13 or 14 bucks a month times 12 times how many years? So it can add up. Just a caveat, be careful, ask for that confirmation. When you turn 65, whether working or retired, call to ask if you need to enroll in Part B. If you're working and covered, we know this, keep a record of the conversation to avoid penalties later. If you're not working or are covered by an under 20 employee plan, they will say yes. I would say good luck calling SSA. When you do that, if you do that, then pour yourself a big cup of coffee, sit in a very comfortable chair, and just be prepared to be on hold for a while. Alternatively, you can speak to someone like myself. We will guide you and direct you. And I have yet, with the hundreds of clients I now have, I have yet to have given anyone bad or incorrect information and sent them down the wrong path. Make sure whoever you speak to is creditable, that they know their business, that it's all they do. Anyone who's licensed to sell life and health insurance can enroll you in a Medigap or a supplement plan. And just because they're licensed to do that doesn't mean that they know the rules. So be cautious. Ensure that the person you're speaking to is someone who specializes in Medicare. Late enrollment penalty, we talked about this. Medicare consists of A and B. A is your hospital insurance. That's the bed, the bath, and as I like to say, the bad jello. Again, Part A is free as long as you have 10 years of work history or 40 quarters of work history. Part B requires a monthly premium. And that monthly premium, by the way, is a function of your modified adjusted gross income for the 2 years prior to enrolling in Medicare. So clients that I'm enrolling in Medicare for November 1st or December 1st, when we apply for Part B, by the way, they don't trust us. They go right to the IRS and pull your tax return. And based on your tax return and what you've reported there, that will determine what your Part B premium is. For 2024, the base premium for someone married filing jointly, the base income is $206,000. So if your income in 2024 is equal to or less than $206,000, married filing jointly, your Part B premium would be $174.70. This slide has not been updated yet. I apologize for that. So if you were paying a penalty, a 1-year penalty of 10%, you would pay an extra $17.40 per month on top of the $174.70 for the rest of your life. And by the way, that penalty increases as that Part B premium increases each year, because it does. Again, this was from 2 years ago. The premium now for the base premium is $174.70. I know that for 2025, the base premium is going to be $185. So your penalty and your premium would increase. And again, the government is very unforgiving on these things, unless you have a really good excuse. If you go on to COBRA after retiring, you must enroll in Part B by the end of the 8th month after employer insurance terminates. If you stay on COBRA the full 18 months without enrolling in Part B, you may be charged a late enrollment penalty. The real rule is that if you are eligible for Medicare, you must enroll in Medicare as quickly as you can, because Medicare becomes your primary coverage. COBRA becomes your secondary coverage. That's an important distinction to make. If you are eligible for Medicare, or when you become eligible for Medicare, if you're on COBRA, you must enroll in Medicare as soon as possible. You cannot stay on for 18 months without enrolling in Part B. You will incur that 10% penalty, and that will last for life. How do you enroll in Medicare? Well, there are 3 ways to do that. The first is through your SSA.gov account. And if you have an SSA.gov account set up, you log in, you scroll down to the bottom. There is a link to enroll in Medicare. You click that link. It takes you to the Medicare site, and you can enroll in Medicare Part A and or Medicare Part B. It will ask you. You can enroll in Medicare Part A if you choose to. As an example, if you're continuing to work, but you're covered by a creditable group plan, which means it covers more than 20 people, and you choose to enroll in Part A, which is free, you can do that through the SSA.gov account. It will ask you if you want to enroll in Part B, you decline it. It's that simple. Option 2 is to call Social Security, set up an appointment. Now, timing is critical in that situation. Understand that there are 12,000 people per day turning 65. So the Social Security Administration, which is who processes the Medicare enrollments, by the way, they're a little bit overwhelmed and overworked. And so generally what I've found is that clients who go that route, they won't get an appointment for 4 to 6 weeks if they want a telephone appointment. So you can do it online, you can set up a telephone appointment, or you can walk into your local Social Security office and enroll. Depending on the office location, you may wait 15 minutes, you may wait 3 hours and 15 minutes. It's a hit or miss situation. Typically in the more highly populated, densely populated areas, the inner cities, Philadelphia, New York, you're going to wait a while. In the suburban areas, I know there are offices over by the ICG Next office where I've had clients walk in, and in 15 or 20 minutes, they're out the door and they're enrolled and it's done. So it's a hit or miss situation, but those are the 3 ways to actually enroll in Medicare. What we're enduring or going through right now, and I say enduring because it's incredibly busy right now, is what's called AEP, and that's annual enrollment period. That's the time of year when you can change Advantage plans or when you can change prescription drug plans. Once you enroll in a Medicare supplement plan or a Medigap plan, you have 6 months from your Part B effective date. Within that 6 months, you can change companies or you can change plans. Once you get outside of that 6-month time frame, in order to change companies or change plans with your supplement or your Medigap plan, you would be required to go through medical underwriting. At that point, they can turn you down, but you would never lose the plan you already have. I have a couple of clients right now that want to try and change plans. I can't make a guarantee because I don't make those final decisions, but they know they won't lose what they have if they get turned down. They want to change for whatever reason. Uh, they were clients that were referred to me, and so it's a relatively new relationship, but they want to change plans. Advantage plans do change every year, and you can change your Advantage plan every year. Advantage plans are what's referred to as Medicare Part C. Advantage plans can and do change, and doctors are in those networks, and doctors step out of those networks for whatever reason. Actually, the reason is that the Advantage plans typically have lower reimbursements for the doctors than original Medicare and supplements do. And so they find it's just not cost effective for them to stay as a participant in any of those plans. There's nothing to hold a doctor to staying in a specific company Advantage plan. And Advantage plans actually terminate their service from time to time. Just in the past 7 days, I've had 5 people referred to me that I didn't work with originally that are enrolled in an Advantage plan, or what's called Medicare Part C, and their plans are being terminated as of December 31st. So we need to enroll them in a new plan that would take effect on January 1st. Same thing applies to your Part D prescription drug plans. You can and should review those drug plans every year because the formularies change for each insurance company every year. And it's the formulary that determines what medications each company will cover, how much they'll cover, and what your out-of-pocket costs will be. The good news is that due to the Inflation Reduction Act for 2025, the maximum out-of-pocket cost for medications for all Medicare beneficiaries is $2,000. Now, the caveat is that the medication needs to be on your drug plan formulary. If it's not on the formulary, that $2,000 cap doesn't apply. What's also important to note about drug plans is that once you're on a drug plan for the year, so right now I'm enrolling clients in new drug plans for 2025. If in April of 2025 or May, one of my clients is prescribed gets a script for a new medication due to a change in their health, a new illness that's diagnosed, and that medication is not on the formulary, the company doesn't have to cover it and honor it. You and your doctor can appeal, but the company doesn't have to honor that appeal. You can appeal to Medicare, and again, Medicare may or may not do anything to help you. And in that case, you would have to pay that expense out of your pocket until the following year when we could enroll you in a new plan and we know what the new formularies are. I know that's a lot of information. We're hitting you with a lot of stuff here. There are a lot of moving parts to this whole process, and that's why you really need solid guidance from someone who understands the rules and can help you navigate this, what is a very confusing and complex process. So, I'm going to speak now just to Medicare, and hopefully wrap this up with an understanding of how Medicare works. Again, Medicare consists of Part A and Part B. A is free, B requires a premium. And by the way, that Part B premium can go as high this year as $594 per person per month. But that assumes that your income in 2023 or 2022 was $750,000 for the year or more. Now, If you are assessed a higher Part B premium and subsequent to that, as a result of retirement, your income declines, or just because your income went down, there is what's called an IRMA appeal. That increase in premium is called an IRMA adjustment. So I also assist clients in completing and filing an IRMA appeal. And in almost every case I've been involved with, uh, Medicare and Social Security will honor that reduction in income, assuming that we provide the appropriate documentation. So it's not a matter of filling out a form and saying, hey, my income declined. We fill out a form and say my income declined because of, and retirement is a good option, but then we need to supply the supporting documentation, W-2s, tax returns, etc. Termination notifications from your employer, retirement notifications from your employer, etc. All that is taken into consideration. So A and B, 80%. The 20% that it doesn't cover is your responsibility, our responsibility individually. And the way to handle that is with a supplement or a Medigap plan. And so B requires a premium. Your supplement or your Medigap plan requires a premium. And then you need a Part D prescription drug plan. That requires a premium as well. And that premium is a function of the medications that you currently take, with the dosage and the frequency. And we help people to analyze and determine an appropriate drug plan for them, not only initially, but on an ongoing basis as well. What I've just described to you is called original Medicare with a supplement and obviously a Part D drug plan. I like to think of it as the Monty Hall approach. What's behind door number one and what's behind door number two. Door number one is original Medicare with that supplement. Door number two is what's referred to as Medicare Part C or Medicare Advantage plans. There are actually 48 different Medicare Advantage plans available. Not every plan would be available in your zip code because they are determined by your zip code. Advantage plans work a little bit differently than the original Medicare does with a supplement. And I'm sure mostly everyone here has seen the commercials on television with William Shatner, Leonard Nimoy, Joe Namath, whoever the spokesperson du jour might be. And one of the things they always stress and promote with Advantage Plan is that there's zero cost, and they give you dental, they give you vision, they give you hearing, they give you a gym membership. What they're not telling you in those commercials and in a lot of those advertisements, they're not telling you that you still have to pay the Part B premium. No one escapes the Part B premium unless you have a very low income, in which case they have Part B give back programs. So you may have a partial Part B give back, but in some way or form, everyone pays the Part B premium, even if you're in an Advantage plan that promotes zero premium. That zero premium refers to the additional benefits and coverage over and above Medicare. Now, what I educate clients to is that when you enroll in an Advantage plan, you have to understand that you are actually leaving the federal government's Medicare system. You're actually no longer part of the government's Medicare system. The Advantage plans are run and managed by independent insurance companies. And in almost every case, by the way, they're the same insurance company that offers the supplements or the Medigap plans, but they're two different sides of the business. And the Advantage plans run and manage those plans, or the insurance companies run and manage those Advantage plans for profit. And so as a result, they employ utilization management strategies. And that's a fancy way of saying that they're going to require a prior authorization. They could require what's called step therapy. And a prior authorization, for example, works like this. I walk out the door. I'm a member of a Advantage plan. I walk out the door, slip, and hurt my back. I go to the doctor. Doctor does an exam and says, you know what, Lou? Let's just get you an MRI. So he writes that script for the MRI. But because of prior authorizations, that script for the MRI has to be approved by the insurance company first, so they can authorize it. They can deny that, or they can delay it, or they can require step therapy. They may come back and say, based on what we see in the report, we don't think Lou needs an MRI. We think Lou can get by with an X-ray first. My position is, if the doctor wanted an X-ray, the doctor would have written a script for an X-ray. But the doctor wanted an MRI because he or she suspects something that requires an MRI to determine. So those are some of the things that you run into with Advantage plans. Advantage plans also work as a network. So you have a network of doctors and hospitals. And as long as you stay within that network, your costs are going to be minimized to an extent. Now, remember I said those Advantage plans typically offer a zero premium. Uh, I just enrolled a client last night in an Advantage plan because she was in an Advantage plan already that terminated, and she's going to pay a $38 a month premium. That $38 a month premium will give her a quarterly stipend to buy over-the-counter products. But the key here is that every Advantage plan carries with it what's called an annual out-of-pocket maximum. That annual out-of-pocket maximum can average right now, I believe for 2025, they're estimating it to be about $7,900. That means depending on where you get your care and your treatment, whether you stay in that network for that Advantage plan or get care and treatment outside of the network, your total out-of-pocket costs can range up to $7,900 and in some cases up to almost $14,000. So those are some of the nuances of the different plans and options that you need to understand and navigate. What you also need to know is that if you go to an Advantage plan initially and you stay in that Advantage plan for more than a year, and then you call me and say, you know what, Lou, you were right. My health changed and I'm spending more money than I anticipated with this Advantage plan. I'd like to go back to original Medicare and get a supplement. If you're in that Advantage plan for more than 1 year, they're going to require now that you go through medical underwriting to enroll in a supplement or a Medigap plan. So some of these decisions become irrevocable, and you really need to understand and make sure that you make the best decision for you based on your specific circumstances. Again, very challenging, very complex.
Obviously, it's very detailed and quite a bit of information out there. For all of our clients and friends on the Zoom presentation today, if you are interested in having a one-on-one complimentary meeting with Lou, just contact your advisor. Everyone knows Lou in the office. He's once again an extension of ICG Next in helping provide these valuable insights and counsel.